slides. Make sure everybody can see those. All right, is everybody seeing the slides?
The minutes there.
Yes.
Okay, great. And I just wanted to remind everyone, if you could make sure that you are muted.
Yeah.
If you're not speaking, that way we do have quite a few people on the call and we will keep the background noise to a minimum. So thank you to everyone for joining us today for our second part of our learning series for the Store It Safe Quality Improvement Project in the great state of Indiana. I'm going to be joined today by Dr. Zhang and Dr. Landman, and we're going to be focused on data and workflows today. Just as a reminder, the presenters today do not have any relevant financial relationships to disclose, and we are very grateful for the Indiana Department of Health and all their support for this project. Again, just a reminder of the practices that are participating in the Quality Improvement Project. They're on the screen, and please make sure that you chat your name and your practice into the chat. That helps us with attendance purposes. So again, as a reminder, just put your name and your practice's name in the chat. And for today, so I have just a few follow-ups that I wanted to go over from our first learning session. They are some questions that a few practices asked, and I always think that sometimes, if it was a question for one person, other folks may be wondering about it. So I'm going to just go over that, talk in detail about the data for the project, and then we have a few just homework kind of reminders. So a few follow-ups. What I wanted to mention that we talked about in learning session 1 about depression and suicidality screening. So as a reminder, you will be doing both a depression screening and a suicidality screening at your adolescent preventative visits for age 12 to 21. The ones that we recommend are for depression screening, either a PHQ-8, a PHQ-9, or a PHQ-A. And then the suicidality screening being either an ASQ, a Columbia, or we do also the SBQR. If you are doing something other than those for depression or suicidality screening already, please email me and let me know what those are. And then I can let you know. We don't like to have practice changing their screenings if they're already doing something, but I just wanted to mention that. And again, if you have any questions about that, let me know. The other thing I wanted to mention, so again, a follow-up from our first learning session. At every age 12 to 21 preventative visit, it's our goal, and that's a well check or a sports physical, to do the Store It Safe interventions. So to do the screenings, to have the lethal means discussion, to offer the Store It Safe resources, to offer the lock boxes, to do your quality improvement data entry, and then to ask that parent or caregiver to complete the voluntary post-appointment survey. Now, we know it's not going to be perfect. It's not going to be at 100%. We set a goal in the project about 80%. So that's what we are kind of looking for. So data, that's what we're going to talk about it today. I always like to start off with why it's important and what we do with it, because it's not just we're having you do it to burden you or make your life difficult. We really, over the waves of the project that we've done, we've tried to be as conscientious about your time with data as possible, because we obviously want you doing clinical care. But we do collect data in the project to help us see if the interventions are happening. We also get data on kind of what will be giving you data on what your population looks like in terms of depression risk and suicidality risk. So on the screen, you're seeing examples of run charts that we've done from other waves. You'll notice that over on the left, you're seeing baseline information. So before the project happened, what was going on with suicidality screening? And then after the project got going, you can see as the data goes to the right, kind of where things were. And same things with lethal means discussion rates. So if we don't look at data, we don't kind of know what's happening with the interventions and with the project. And so we're going to get into some of the details a little bit. Some of this is going to be review. We've talked about this when we first talked about the project. You've probably read through it in the recruitment packet, but I just like to talk about it. So again, and you've already done some of the data, but just to kind of keep it fresh in everybody's mind. So there's really four main buckets of data that we look at in the project: the confidence data, the pre-work survey data, baseline data, and then the monthly action period data. So I'm going to go through each of these. As a reminder, with everything in this project, I keep stressing this, the team approach is always so helpful. It's not on any one person's, back to do all of the data entry. It's the team approach from your practice. So I kind of like to mention that and highlight that again for you. So confidence data. Many of you have already done this. It's a very brief survey. It probably takes about a minute to do. You'll have the link. I'll again send that out in the follow-up email. We do it prior to the project, and then we do it at the end of the project. Every participating provider in the project will be doing this. You should already have done your pre-program data, confidence data, but if you haven't, it's not a problem because we technically really haven't got totally going yet. But I'll be sending out this link again and reminding folks who haven't done it, and then we'll do it again at the end. And it again helps tell us just how you feel about what you've learned. Are you more confident in doing these type of interventions? And are you more confident in your screening practices, in discussing suicide risk, those kind of things? And then the pre-work survey data. Again, many of you have already done this. It's a brief survey that just gives us a lot more information about your practice. We only need one of these completed, so not per practice, not everyone in the practice is doing it. And it's typically best that it's completed by the lead provider with the assistance of the office manager. And again, most of you have already done this. If anyone hasn't, I will send the link to you with a reminder. Baseline data. So this is the one we haven't talked as much about. We don't expect you to have it done until the end of July. And again, I'm going to send this to you all in writing, and I will send you the link. It's very brief to enter. It probably takes about a minute per chart. The only way we can really get it is by chart review, because we're looking back at the months of July, September, and November. And what we're going to be wanting to see is really, did that chart, that random chart, have a depression screening? Did they have a suicidality screening? Did they have a legal means discussion? It's really those three main points that we're looking at. And again, when I send you the link, you'll be able to see what it's like to enter this. And it's like very brief, but it will end up being 21 charts per participating provider. What I would like you to start doing now is think about who is going to do the chart reviews and do this. It could be an administrative assistant, it could be a medical student, it could be the provider, but every provider that's participating will have those 21 chart reviews for their baseline data for the months of July, September, and November of 2024. So we're looking back at like last year. Again, if you have any questions about this after I send it all to you in writing and send you the link, please feel free to let me know, and I'm happy to work with you all on this. Like I said, we want to have this completed by the end of July. And then the monthly action period data. This is every month now from July to December that we're going to be looking at and entering on the iPads to see if the interventions are occurring as you're doing the appointments. So provider and clinic staff will enter some of the data, and then parents, if they want, will enter the remainder of the data. So you should have your iPads in hand. We sent those out, and I think we saw confirmation that everyone had gotten those. If you, for some reason, don't have your iPads, let me know. It may be that somebody at your practice, picked them up or got them delivered to them. So iPad data entry during and after every age 12 to 21 preventative visit for a well or sports physical, and that will start on July 1. The way we do this is that we're going to be looking at rates. So we're going to look at your rate of depression screening, your rate of suicidality screening. So every month I will have to go to your office manager and know the total number of age to 12 to 21 preventative visits per month per practice. And so again, start thinking about who is the person at your practice that'll be able to provide that. I'll be giving every practice a spreadsheet, and we'll just have these entered every month. And typically it is the office manager. So kind of at the end of the month, I'll reach out and ask for this, and then we will kind of go from there. If a practice is struggling, though, what we often have to do is look at the data at a provider level. So it's best to just go ahead and provide the denominator numbers from the get-go by provider. So that's why when I send you your spreadsheet, it'll have all the providers listed. And then for that month, you'll just tell me how many, Dr. Jones had, how many appointments Dr. Spicer had, and we'll go from there. So, to use July as an example, we're all going to start entering data in July. By the 5th of August, we expect all the July data to be done, and you've provided me the denominator, and then that way we can run all of the month's data. For most of you, again, I think I've gotten everyone's name and credential. But if you have not, or if you've added any providers, please make sure you just send me an email with that information so that I have all the names and credentials of any providers in your practice that are participating. Just wanted to show you this to say when we do send you monthly data, this is what you're going to see. There's going to be several data run charts. The very first thing we need is we need to see you entering data. So the first chart we're going to look at is what's the rate that you're actually completing data entry. It's kind of like with your charting. If you don't put it in the chart, it didn't happen. If you don't enter the data, we have to assume that none of these interventions happen. So that's the first thing. And again, I know that data entry is going to be new with this, so it's not going to be up there to start. But we like to kind of get into a groove of getting that done. And then from that, we'll see with your depression screening rate. There'll be a bar chart to show you for your population where we do have data entry. What does that risk profile look like? Same thing for the suicidality screening rate. And then for the lethal means discussion rate, again, that's looking at how many appointments did you have that month in that age range? And then of those, how many did you indicate received a lethal means discussion? How many received the resources? How many accepted the resources? How many were offered a lockbox? How many accepted the lockbox? And then we also look at, of those patients who were at risk on depression or the suicidality screening, how many did you indicate received some type of treatment plan, either an initiated or continued one? And then there is some data regarding the family feedback surveys. Again, knowing that those are voluntary and anonymous, we do look at the completion rate. We tend to see that pretty high, actually. And then from that, families report, did they receive a legal means discussion? Did they receive resources? What's the likelihood they're going to make changes based on the conversations at the appointment? And have they ever had anyone outside of their child's provider talk to them about these kind of risks? So the iPads, again, you should have them in hand. If you don't, please let me know that. Send me an email. And then you should also have your charger. So one of the first things to think about with, you probably go through this with your own iPads at home, is they do have to be kept charged and ready to go each day. So think about even that, where you're going to store them, who's going to be responsible for making sure they're plugged up overnight and charged and kind of ready to go. And then the very first thing you're going to want to do is power on your iPad and get it on your clinic Wi-Fi. Again, if you have any trouble with the iPads, please feel free to let me know, and we'll make sure we get you some help with that. But they're pretty simple. They're kind of streamlined in what they do. So it's usually a pretty easy process. So again, if you power on your iPad, you're going to have it, it's going to look very similar to the picture on the left. And you'll see this little purple, kind of with the little bands at the bottom. That's how you can get on your clinic Wi-Fi and put your password in. And then that store it safe button down beside the purple button is what will get you kind of into the data entry portion. And I'm just gonna, you're gonna have the link, but I'm gonna show you this in a minute when we enter data, but that's gonna be, again, how you enter the data on the iPad for the monthly data entry. So we're gonna kind of put all this together now. We talked last time about screening and lethal means restriction discussion, and now we've talked about data. So again, keep in mind, you're gonna have all these slides, and you're also gonna have a blank workflow that you can kind of tweak and kind of make edits to based on your practice. So we're going to talk about with screening that you're doing kind of a recommended workflow with the lethal means restriction discussions, with giving resources, and then with data entry. I want to stress, like we talked about in the first session, that these are our recommendations. Every practice is different. You know your practice better than we do, and you know what's going to work for your practice. We don't expect everyone to do this exactly the same. We're expecting there to be tweaks or things. We want these things to work for your practice long term. So don't feel like this is how you have to do it. I'm just going to talk about kind of some general ideas, and then I'm here to help each of you figure out what works best for your practice. So this is a very kind of detailed, messy kind of flow. This is exactly what you're going to submit to me for your workflow. I'm going to give you a blank one, and you're going to make some tweaks. So it goes all the way from a patient checking in all the way through all of the storage safe interventions and then data entry. So I'm not going to go through all this screen in detail because we're kind of going to break it down, but I just wanted you to have a look at what, kind of a workflow looks like for this project. And then, like I said, you're going to have this that you're going to be able to tweak and make modifications to. So again, teamwork, you may have the front office staff doing portions of your workflows. You may have your clinical staff, MAs or nurses, and then you're going to have your providers doing portions of things. So let's just talk about kind of a few recommendations that you might have the front office staff do. So the front office staff might be who checks that the iPad is charged and ready for the day. And then at check-in, they may actually give the paper, or if you have some other tablet that you use that actually have the screenings on them, they may give those screenings to the patients to complete in the waiting room. And then at the end of the day, they may be the person that double checks that all the iPads are charging and put away where they're supposed to go. Then your clinical staff, so MA, nurse, those folks, sorry, I'm doing a lot of clicking to try to get this to come up. They may pick up the iPad from the designated area for the day. They may collect and score the screenings that the patients have done, and they may press the home button that's on the iPad and get that icon up and actually start the data entry on our data collection tool on the iPad. And I'll show you some of this in a moment, kind of what it could look like. And then they may complete entering that screening data on the iPad. They may room the patient, and then they may press the button on the top of the iPad, put it to sleep, and leave it in the room for the provider. And then the provider's portion of the appointment and the data entry, it might be they pick up the iPad, press the home button twice, and that sort of brings the iPad back up right where it was left off, review the screening results, press the button on the top of the iPad and put the iPad to sleep, complete the visit, including having the lethal means discussion, provide the resources, offer the safety lockbox. Again, press the button on the iPad, complete final data entry, and hit submit. Now, that's a lot of steps. For someone to be thinking about doing. I'm breaking it down into excruciating detail, but it'll make more sense when you start playing around with the iPads and seeing how it works. It also may be that this isn't the way that you want to do it, that this isn't the way that works best. And again, we can talk about all of that. Once that final data is entered for that appointment, that's when there'll be buttons that come up. There's a dark blue and a light blue, basically asking, is a caregiver present? If a caregiver isn't present at the appointment, you say that, you select that button, and you're kind of done. But if a caregiver is present, that's when you can ask the caregiver if they would like to complete the after appointment survey. And then again, they would press the button for that. The parent or caregiver would complete their portion of the survey, which again is very quick. They hit submit and everything's done. You would double check that, and then the data is submitted, and you return the iPad to the designated area. And again, this is just an example of all of that kind of put together in one flow. So I'm going to kind of stop there and just see if there's any questions before we kind of go through a case, and then I actually show you kind of data entry. Liz, do we have any questions in the chat?
We just received one. Is there a way to get to the parent survey without completing the first section? We are planning on having another staff member enter data who is not next to the parents.
Okay, great. And so at this point, no, there isn't, but we have heard that feedback from some practices, so we are going to make that so that that's possible to do. So great point. Thank you for letting us know that. All right.
There's
so
one more
let's.
that just popped
Oh,
in,
go ahead.
Kristen. Sorry. Any advice on how to keep the iPad safe? Other colleagues said this is hard.
Yeah, so I will tell you, someone did ask me that as well. I'm going to knock on wood. I don't know if it's real wood or fake wood, but we have never had an iPad walkout in, gosh, I don't know how many waves that we've done. I think, just some basic strategies, like I said, always having like when you hand that iPad to a parent to complete the survey, they complete it and they hand it back to a staff member. Keeping the iPads not kind of in just loose places, just having spots for them. But I have to tell you, we have not had a problem with iPads vanishing.
And one more here. Will that be possible to have the parent survey available for us on July 1st?
Yes, it will be. Yes, right now they're connected together just because of that flow process. But yes, we'll be able to have it separated so that you can go ahead on July 1st and start doing it with them separated. And I'll check in with any practices that, want to do that so we can talk about that a little more. All right, so let's start with the case and then we'll kind of go through data entry for the case. So this is Rose. She's a 13-year-old white female who comes to your office for a well visit. English is her family's chosen language. She has Medicaid insurance and she lives in the 343065 zip code. Her mom brings her to the visit. She checks in at the front desk and completes the depression and suicidality screening. She scores in the at-risk mild range for depression, and no potential risk is identified for suicidality. Rose does not currently have a treatment plan in place for depression. Based on her depression screening results, you schedule her back to do a more thorough assessment of her depression and discuss treatment options. You discuss all lethal means restriction with Rose's mother and offer her a safety lockbox. Her mother declines the lockbox as she already has unsafe items locked away. You do forget to discuss or offer the store safe resources to Rose and her mother. Rose's mother agrees to complete the post-appointment family survey. So I'm going to just show you, I'm going to pull up the data collection form. Did it switch over to you all? Can you all see this now?
Yes.
Okay, great. So this is what it's going to kind of look like on the iPad. So we're going to pretend that I am Dr. Kalmeyer. So I will select my practice name. And for many of you, because you have multiple providers, you'll be selecting the name of the provider. I'll just show you another one so that we see, it'll drop down for the names of providers. That's why it's very important I have all those so that we make sure they're entered. So you'll select that. You'll select the date of the visit, which today is the 18th. You'll select the age of the patient. Rose was 13, I think. Her gender identity. And again, so you're entering this. This is what, your the report of her gender identity is as best you know. Her ethnicity was not Hispanic or Latino. She was white and she had Medicaid insurance. And then her zip code was 43065. You'll enter that. it'll bring you to a screen to ask you about depression. So we did complete the depression screening, and then based one of those three, and then based on that screening, you will enter what her score was. So the score is actually entered. It was at risk mild. She was screened for suicidality. We're just going to say we used an ASQ. Depending on which one you choose, the appropriate scoring options pop up, but an ASQ, and there was no risk identified. Now, when you click next, it will bring up so that you actually see what the results of those screenings were. So on the iPad, you will be seeing that, so you'll know what those were. We did discuss all of the items to keep locked away. We did not discuss the resources. I think we forgot to do that. And we didn't offer them, but we did offer a lockbox, and they did decline the lockbox, so we're selecting no. If you want to enter the reason,
Kristen, you're on mute.
I've been on mute this whole time.
Just
I
the
hope
past
not.
minute.
Good. Okay. I'm glad I must have hit a button. So I was saying, based on the results of this screening, our plan was to bring her back into the office so that there could be additional follow-up. So what we're going to say is that a new treatment plan in the practice was initiated based on those results. Now, if she already had a treatment plan and there was some type of modification, there's options there to select that, or if a referral was made. So again, and you can select, you can kind of see that if you select a new treatment plan was initiated, it's going to ask you.
You've hit mute again, Kristen.
Why am I hitting? I don't even know how I'm hitting mute. Sorry. So we're going to select close primary care follow-up for her. And then we did say that a parent or caregiver was present, so we will select yes. If there's any other information you want to provide, you can provide that in the box. And then you hit submit. And now your data has been entered. So it's there, it's done. And then this is where there's these two buttons. If a parent or caregiver is present, you're going to click the light blue. If they were not present, you'll click dark blue and it'll just refresh the screen and you're done. But if you click the light blue, you'll see that it will go for the family to this survey. There's a bit of a descriptor about, that it's voluntary, it's not being used for purposes. And then the family goes through this section as well. So they would select their practice, again, what provider they saw. They will enter their zip code. They will select the gender, all of the same information that you entered. And then they will enter what their perception was of the discussion. So they'll enter all of that. They'll make an entry about whether they plan to make changes and select that. They'll answer if anyone has spoken to them about the risk, yes or no. And then again, if there's anything they want to enter, they can enter it there. And then they'll hit submit and their data entry is done. And then there's a place here again where when you get the iPad back, you just click and it'll refresh the data entry. So, and then all the data is done and kind of entered. So hopefully that kind of gives you an idea. I'm going to go back and pull my slides back up. Here we go. All right, again, I'm going to pause there and just see if there are any questions from that portion.
So there's one from the previous portion asking if the offices will be receiving the additional resources that you mentioned for patients prior to July 1st.
Yes. Yep.
Okay.
So those will be shipping out on Monday. You will be getting some lock boxes, and then the order for all of the resources has gone to the printer. So I'll double check on what date those will be shipping out, but it should be next week.
And are the family surveys available in other languages?
Yes, they are. That's a great question. So if you look on your iPad, when you get to that family survey, there's a little drop down button, and the family can click on that, and it's represented as even a flag, so of different languages, that once they click on their language, then the family survey is in that language. And if you find that there's any languages we need to add there, we've added languages that you indicated in your pre-work survey. But if you find there's any that aren't there that we need there, just let me know and we can add those easily. Any other questions at this point? All right, let's talk about a few reminders for homework. So again, I'm going to send you your link to the website that will have all of the Indiana resources on it. I want you to just take a look at that, know that it's there, and you will be able to, again, share that link with families, included in after visit summaries. But I'll make sure that you have that in the follow-up email. As we mentioned, printed resources and lockboxes are being shipped out to you. So be on the lookout for those and let me know if you're not seeing them like end of next week or so. You will be completing a workflow. That's one of the requirements for quality improvement projects, and we'll need to have that submitted by the middle of July. I'm here to help you with that based on what we've talked about today and the template that I will send you. So I'm happy to help if anyone has any questions, but these kind of questions like we talked about of how you're going to tweak this for your practice, that's exactly what you want to be highlighting in your workflows. Make sure you've completed that pre-work survey. I will remind any of you who haven't and send you the link. Make sure all your participating providers have completed their confidence survey. Again, if you haven't, you'll get a link and a reminder. Making sure that I have all the names and credentials so that I can update that in the data entry and just have that all clear for our records. And then start planning for entering baseline data. Like I said, it's due at the end of July, but start thinking about who's going to be doing that and a plan for getting that done. And again, I'm here to help with that process. And then July 1 is the start date. That's the start date to start doing the intervention, start doing the screening, start having the discussions, start entering your data. Remember, it's not going to be perfect, but that's our official start of data reporting. With that in mind, remember that we do have another learning session coming up on July 2nd from 12 to 1. It's a full hour because we really get into the nitty gritty of how to have lethal means restriction discussion during those adolescent visits. We are joined by colleagues from Cincinnati Children's who have developed a really cool virtual reality kind of avatar session where you get to practice these discussions with cooperative and non-cooperative avatars. So it's really a great learning process. And we would love to have as many of your participating providers as possible attend since you do get to practice. So don't be shy when it comes time and they ask for volunteers. Don't we all hate when someone asks for a volunteer and it's dead silence? So please make sure when we have that session, you're ready to kind of give it a try and practice. And I'll be adding a Zoom link to that invite because just the session works better with Zoom. So if any of your organizations have any issues with using Zoom, let me know that as well. I've encountered that in the past, but hopefully that won't be an issue. And then as always, you have my email. You also have my cell. Don't hesitate when questions come up to let me know. I know it's a lot of information. It's a lot new kind of process. So anytime you have questions, I'm always happy to answer them and again, help you figure out what's going to work best in your practice. Any more questions in the chat, Liz? Or anybody want to come off mute and have questions, please feel free.
I see that one provider does not support Zoom.
Oh, and would you mind telling me who that is?
Yes, it is Dr. Eskenazi.
It's the Eskenazi health system, so there are several providers from that group.
Okay, thanks for letting me know that. So I will check with our Cincinnati friends and see if there's a way we can use something other than Zoom.
And Parkview also may not
Okay.
offer Zoom.
Okay.
And we have a thank you. This has been great, which I will also echo.
Well, thank you. I know it's a lot of information, and I feel like I'm just like blah 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 blah. Do this, do that, do this, do that, do this, do that. And when you hear it all, it sounds like a lot. I promise you, it's really not. You'll get into the flow of it when you get started, and it'll feel great. The other thing, just to mention, when the resources come out to you, just check them, make sure you've got everything. And like I said, I'll update all of you with the dates that those ship out, and then I'll have tracking so that we can make sure you get everything. Any other questions?
There's another comment about, yes, this is very helpful and can't wait for the resources.
Great. All right, and I will send a follow-up email to everyone either today or tomorrow. It'll have slides, links, reminders, all the fun stuff that you love seeing from me come into your email inbox every day. Thanks so much for joining us today, everybody, and hope everybody has a great day.
Oh,
Oh, sorry. Is there any more?
one more. Wanted to make sure this is only supposed to be done in the setting of well child and not other visits.
Yep, we call it, quote, preventative visits. So those are age 12 to 21 well visits or sports physicals. We encourage you, when you have that sports physical opportunity with a patient, to do the screenings, to have the discussions, to provide the resources. Because we know with adolescents, they often don't come to their well visits, but they might come to a sports physical. So if you get them and you have the opportunity to find out if they're at risk and struggling with any of these issues, take it and try to do this. So that's the denominator number that we look at for the number of appointments. We ask how many age 12 to 21 well visit and sports physicals did you have in this past month? So that's the number we get your rate from. Great question. All right.
That
If
is all.
that's
Thank you.
If that's all, again, please let me know if other questions come up. Happy to answer, and we look forward to our next learning session on July 2nd. Thanks, everybody.
Thank you.
Thanks so much. Everybody have a good day.